Hello and welcome to lecture M6.11, Evaluating Websites and Information Online. This lecture applies to students in Dublin, Bahrain and Penang, but please note in this lecture that library access details may differ and I'll make reference to those. So the learning outcomes for this lecture are as follows. Students should be able to demonstrate the ability to determine the validity of a healthcare website using the following criteria: authority, accuracy, objectivity, coverage, currency and design, and I'll cover those in more detail in the lecture obviously. And something I am revisiting in this lecture to view and understand the nature of the websites PubMed and Medline. And yes, as I say, we're doing this again. It's really important that students come to grips with those two sites. And finally then, we just want to look very, very briefly at something called peer review. And I want to take another look at the Student BMJ and the New England Journal of Medicine. Also, I'd ask students to review all the documents and links associated with this lecture. So there's quite a few. It's not going to take a huge amount of time, but it's important that you do so. There are PDFs which I'll make reference to and links within the presentation itself. There's also a couple of short videos, and one in particular from the National Cancer Institute in the United States. This should become apparent as we go on. So, first and foremost, I'd like you to take a look at this paper, Published Criteria for Evaluating Health-Related Websites, a review. Again, as I've said to students, I want students to understand this paper word for word, but you do have to read it. And then also another paper here, Frustrated and Confused, the American Public Rates its Cancer-Related Information Seeking Experiences. So this is a population-based assessment of the barriers faced by people searching for cancer information. That's what people do. They get bad news, they look it up. Dates are irrelevant here to some degree. We're talking about a behaviour. So let's just take a look and think about how can we trust what we read online. And look at this very fit and healthy looking man. Look, he's kind of slightly greying, which may infer that he's clever. I don't know. He's got glasses on, stethoscope around his neck, phone. Fantastic. We trust this man, don't we? 100% confidential. They've even made a little badge, satisfaction guaranteed. This is great. It has everything going for it. And of course, this air of respectability in that they have live online help, which is offline in this picture. Lots of visual signals going on there to tell us that we should trust this website, wherever it might be. And this is really the crux of the problem. Now today, as early October, I've just typed in lose weight. You'll all have seen these ads on your social media profiles. They get popped in for whatever reason. They come up all over the place. A lot of websites out there about losing weight. So I put in lose weight, 107 million results. And you can see the way Google is stacked here. We get specifically placed ads here, advertisements. The Motivation Clinic is a service in Dublin, and it motivate people to lose, look at that, 1 stone, metric weights, or imperial weights, European, maybe, or Irish English rather. For €25, they're going to give you the promise of 1 stone in 4 weeks. Westwood are gyms, gymnasia, located around the city, and on it goes. So health and nutrition advice, all advertising, more advertising here. 5 foods you must not eat. I wonder what on earth that could be. Look, you get the feeling you know this. What can we trust, I suppose, is the issue here. WebMD, that looks promising, but you get the idea. A lot of confusing information. No particular big visual signal there that anything is of good value or bad value. We'd have to go and do some investigation. And of course, if you lose weight, people don't want to lose weight. They want to lose it fast. and I put in those. So Westwood here actually have the gymnasium. You can lose weight fast. So they actually put those words in, knowing that people will react or their web search will bring them here. The best way to lose weight in a week by Cosmopolitan, which is a commercial magazine, and on it goes. Who can we trust? A gastric band pill. I wonder what on earth that is. Look, you get the idea. 52 million results. Um, where on earth do we go? This is what people, certainly in the West, or the more developed world, isn't it amazing? People are trying to lose weight, so it's all down to consumption. And I've just grabbed this screen grab very recently. This is gone into very slick presentation, iPhone apps. Just because it's an app doesn't mean we can trust it or treat it. That's very hard to tell. Yes, we have success stories, like a dietary diary maybe, recipes, and then these pharmacies here, McCabe's Pharmacy, based in Dublin. So Celebrity Slim, this is, as you can see, a very particular pitch, and they've got Twitter feeds, Facebook accounts, and everything else. So it's free. I very much doubt that. I'd say what they're trying to do is get in and sell you products. But again, look, very slick, nice models, nice setup, apps to legitimize it, social network presence. So it looks all very sophisticated and all very inviting, perhaps. So what are the problems we're faced when we look at a website? Well, I suppose first and foremost, anybody can publish. If you've got a computer and an internet connection, you can publish. Indeed, if you've got a telephone, you can publish a website. Somebody else can do it for you. We could walk in and ask somebody to pay them to do it for you. So simple. The issue with the internet, as you will know, is that it's just, well, there's lots of publications out there. It's also a place for people to stand on their soapbox, as the phrase is, a place to shout, a place for people to vent their frustrations, their opinions, not necessarily in a regulated manner. And because of this, we're looking at information. We don't know who's doing the shouting or the talking or the publishing. And it can be very difficult to determine who wrote something. And this is always, we'll get to peer review in the end. This is information that's been written by somebody. We can identify authors. That's not the case on the internet, or can be in certain circumstances. And there's a lack of basic quality standards. We don't get assurances of quality of information, and it's unfiltered. We get a lot of information, and what we're faced with is rubbish in, truth out. A lot of the internet is presented in a very slick, very formal or informal way, but very certainly well designed in most cases. And it looks like it must be good or it must be true, which is not the case. A good overview of this is the National Cancer Institute in the United States. Again, you see the National Institute of Health, an umbrella organisation. This is a government-run site, .gov, you can see there. You can't set up a .gov site in the United States without some sanction from the government. The URL is there, and it goes through how can you be careful about cancer information on websites, Twitter, YouTube, blogs, Facebook, and email. Lots of services, same issue, aimed at patients. So just give that a quick look and to see where the National Cancer Institute is coming from. So that's the title of the paper, and I've got through it quickly. It says online sources of health information should make it easy for people to learn. Well, that's absolutely right. Of course, it should be easy to learn who is responsible for posting information, the original source of the information that is posted, and the medical credentials of the people who prepare or review material that is posted. So look at that. Who and how are they qualified to do so? And in that link, again, aimed at patients, so it is fairly straightforward. It's for a broad appeal. It dissects, if you like, the anatomy of a cancer scam. And it's in some ways a little shocking that people are prepared to try and take money off people who are vulnerable and sick. But that's the nature of money. People will try and take it off each other. So the Federal Trade Commission, who are worried about this fake treatments, fake drugs, so they've issued this treatment of how patients need to be careful, and that's embedded in that link. Please take a look at it. Um, so what we're after, if we're digging deeper into a site, is who manages the information. Uh, the person or group that has published health information online should be identified somewhere. Now, that would really appear to be very, very basic and rudimentary information, but go and look at a lot of websites next time you're there, and you'll do this in this lecture as a part of an exercise. Try to find out who's written something, and it's not always apparent. And then, of course, the really important question is who's paying? What's their purpose? And look under About Us or Contact Us. It should be there on a website. Who's actually footing the bill? And what's the original source of the information that people have posted? If the information was originally published in a research journal or a book, there should be a link back to that information. They're not just making it up. They've published it somewhere and they're referring to that information online. So, most health information have someone with medical or research credentials. So we're looking at someone who has earned a doctorate or medical degree. Um, so that the reviewer will have written, somebody will have written it, and somebody with similar credentials will review the information. Also, if you look at a website, pay attention to when the information was published. It's October 2014 now. Um, I've made reference to dates, but you go look at a site, say, hold on a minute, this hasn't been updated for a year, 2 years, whatever. And in some commercial sites, that can be hidden or not apparent because they're not interested in when it was published, they just want you to spend some money. And if a site is asking for personal information, you should know how that information will be used, how your privacy will be protected. And this is really very important for everybody. We'll get to that, an example of that in the New England Journal of Medicine in a little while. But don't share your personal information. I know you're very aware of this, but we kind of get used to it now. We accept terms and conditions and we just move on and get the service. One of the things is relevant in this situation is where a person is shouting about their something they're concerned about. They may be suffering. They may have an agenda, but it could be a person's individual page, and sometimes you can tell that by reading the website address if there's a name in it, or users, or members, or people, those kind of things, or odd characters. It's not always a tried and trusted method, but you should always pay attention to the URL. Uh, Patients and personal pages are not necessarily a bad thing, but you will also need to investigate the author fully if you're going to rely on this information. You may present your research project in college here and you make a statement that people in, let's say, the Isle of Man, which is a small island off the coast of Ireland, between England and Ireland, or the United Kingdom and Ireland, people in the Isle of Man have get more hip replacements, making all this up. And we would ask you, where did you find that information? And you say, I found it on a website. Great. Which website? Who wrote that information? So you need to know where information comes from. Um, for personal pages as well, you need to have there's a publisher or domain owner who's vouching for the information, and that may or may not be apparent. Very often people can publish a web page and the owner of the domain doesn't really care what is said and puts a disclaimer up to that effect. So if we get into the actual mechanics of website ownership, if you're going to put up a website fixyourknee.com or whatever it might be. Although it doesn't cost a lot, it does cost some money. And if a site has a good design and it has a unique URL, uh, somebody will have paid for that. So you need to look at the URL. As I said, the GOV is a government agency. .edu is educational. .org is professional organisations, scientific research, advocacy groups. And if you want to register these .org, .edu, .gov, there can be regulations that you must comply with, and you need to supply documentation and declare an interest before you can register that domain. It's not 100% bulletproof. Certainly in the .gov, it is. The American government guard it closely. And we're down here with .com, a commercial website. Could be anything. Sometimes a hospital, sometimes it can be, I know certainly in the college's case, we've used .com domains, but that's in an effort to stop other people using them. The What we're trying to identify is what's educational, non-profit, commercial, government, etc. We're trying to put domain names into groups. And of course, now we have a wider context here about social media. And think about this from your own self. There are plenty of social media presences, but invariably, if there is some worth behind a social media presence, a professional social media presence, they will have a website, they will have a physical address, they will have a building as somewhere to go, they'll have something else other than just a Facebook, YouTube, or Twitter account, or whatever it may be. And ask yourself the question, would you send a patient to another healthcare professional you saw on social media? And I suppose I could just say, you saw only on social media. And the answer to that would be a resounding no, because you would have to find out something else about this person. Here's an interesting article which I'd like everybody to read. And it is about the partnership between patients and doctors or healthcare professionals. And the title is in itself, I suppose, a little bit catchy. Some doctor-patient social media relationships are not suitable for work. NSFW. There's the URL. Please follow it and read it. Here's some research from early last year. These figures will only have increased. 81% of US adults use the internet. Well, that's probably a given. You're probably asking yourself, why isn't it bigger? Well, think about the people maybe who are socially disadvantaged or don't have access to computers for whatever reason. And I think the figures here is that a lot of people, 60% of this group would look for health information online. And 35% say they've gone online specifically to try and figure out what medical condition they have or someone else might have. So they're trying to diagnose themselves rather than just having information or being told something by a medical professional. They're working out what happens. I have a pain in my lower back. What could that mean? So the online resources join the stream of information flowing from people's interactions with clinicians, family, and fellow patients. So there's a lot more going on these days, a lot more information knocking around out there. So deeper into this Pew Internet study in early 2013, how people had actually found the information, where they went. And 3/4 of these people, 77%, began with a search engine. Well, fair enough, they just jumped straight in. And only 13% went to some site that specialises in health information like WebMD. 2% said they started a site at a more general site like Wikipedia, and 1% said they started in social media. They still did. That probably increased slightly, but not much, I would imagine. But what people is, they jump into the search engine and go. It's a bit like starting a journey and just walking out to the road and seeing where the traffic takes you. So from your angle, you're looking as a professional to influence that 13% and get people to use good websites. So take a look at this graphic. Um, so this group of people looking for information, uh, 16% tried to find others who might share the same health concerns. So these are groups of people seeking out other online users who share the same complaint. Uh, then we have, and we're slightly commercial here, our quality assurance driven, that 30% of people are looking for a ranking. Is this physician or physiotherapist any good? Does he have a ranking? And rankings are very difficult to determine. Again, we don't know what the criteria was of why they were made up. Um, so you can see then in the third part, about a quarter, 26% of internet users have read or watched somebody else's experience. So we're looking there. Uh, well, I will try and find somebody, or people are saying, I wonder if that hospital or that physician or that service is any good, or that there's somebody who has something that I have, I think, and I'm going to read about their experiences. Very interestingly, again, part of this Pew Internet report, 1 in 4 people seeking health information said they came up against a paywall, some system where they were asked to put money in, to or credit card details perhaps, to pay a fee, and that is a little concerning. Very quickly people were drawn in to spend money. It doesn't necessarily that they did, but they experienced a situation where they would have to make a decision to spend money. I just took a little time out here to again illustrate the point about searching for information online. If we go back to the 70% of people, 77% of people who started with Google, and this is just to illustrate the auto suggest feature, which can be turned on and off in Google. But let's say that I typed in PARA, and for whatever reason, Google are not going to tell me exactly why. Maybe they know that I'm based at a medical school, who knows, but paracetamol starts to turn up. Paranormal activity, paralegal, okay. When I start to dig down into the word or type a few more letters, you can see it's starting to complete it for me. Paracetamol during pregnancy overdose and dosage. It brings me to a Wikipedia page. This is all Google's doing. I've done nothing as such. I've just started to type. And then when I type the words during, it gives me more refined searches during pregnancy, during labour, during pregnancy, third trimester, and so on. And we can see there that we're getting into it's starting to suggest different types of websites there. That was just general Wikipedia, and then down to the NHS, National Health Service in the United Kingdom. Now, what does this illustrate? It illustrates that Google is guiding us both in terms of how we search, the keywords we look for, and the results. So there are bigger powers at play here, and they are commercially driven. Whereas Google will and do present as an information source, they have a commercial imperative. One of the bigger areas, and it's difficult to cover it all here, is also, but you should be aware of it, are the amount of illegal pharmaceutical products, drugs essentially. I suppose they are illegal drugs in this case. We're not talking about recreational drug use. It says in this Irish Medicines Board report that that's close on 850,000 dosage units of counterfeit and illegal medicines were detained by the IMB in 2010. That means they were stopped at the point of entry by the post office and the police, and that's almost doubled in a year. And as you can see, of that 820,000, close to 300,000 were to do weight loss. So we're back in that murky area that I started the lecture with about where people go, where the money is being made online. So The chief executive at the time, Pat O'Mahony, has said the majority of the detections relate to mail order importations of prescription only medicines. So people, not only will they be able to research what's wrong with them when they encounter you, they'll also be able to research what drugs they can take to make them feel better. And of course, the quality of those drugs we have absolutely no control over. And of course, the strong recommendation from the Irish Medicines Board is that they strongly recommend members of the public never purchase medicines online, as there's no guarantee to the safety, quality, effectiveness of these products. That's a very strong and plain message, but yet, in a very small country, which Ireland is, 820,000 dosage units were detained. Like everything else, you'd have to worry how many weren't detained and ended up being used by people in Ireland. So let's look at the criteria for evaluating websites. I have outlined 6 in total, and it is a mix of these 6, and we'll go through each of them in turn with some examples. Authority, accuracy, objectivity, coverage, currency, design. So to illustrate the point, in the next set of slides, there's links in them. So please take a little time as you go through this and look at the websites that I described to you. And take a look at how you might evaluate them, as I'm making some judgments and you can make them too. So let's look at authority. So something the website the author's clearly defined. The credentials are listed. So what are these credentials? If the person said they're medically qualified, where is their degree from? When did they get it? Can you find the listing for this person? I could certainly present myself as a orthopedic surgeon, but that just blatantly isn't true. In Ireland, there is the Medical Council Public Information Register, the medical register, which we can check. I'm unsure of the situation in the Middle East and the Far East, in Bahrain and Penang, but everybody's free to check any medic and find the registration number there. Also, is this person who is providing the service of the website affiliated with another organisation? Do they say they work in the Royal College of Surgeons, or they have contacts in Penang Medical College? You need to look at that and find out if it's true, of course. And what authority does this person have on the subject? Have they published about the subject? Do they work? Do they collaborate? Do they treat people in this area? And they actually may not, in the case of somebody who's behaving fraudulently. And the absolute easy test for all of this for me is, how do you contact this person? And I think some commercial websites, they are some fraudulent websites. You look at, there's no phone number, there's no street address. There's no street address. There's no way to actually physically contact these people, and that can be an immediate red flag of caution. So, accuracy. Now, if we're looking at something we don't understand and we've not encountered before, this can be difficult, obviously, because we don't know if the information is accurate. But if they do make a claim, as I said, about patients in the Isle of Man, people in the Isle of Man being more prone to hip replacement, we need to know where this information came from. Is there a link back to the original journal where this information was published? Otherwise, it's just made up. 99% of people think this product is brilliant. This product changed their life. Well, in a lot of cases, that is market research, and it is people paid to give their opinions. So we need to go back to good research and find out where that's from, and establish that link. In some cases, you may even be given the research methods. We interviewed XYZ people. Now, even if that information is given, I would always ask, why wasn't this published elsewhere? Because what somebody has done has just collected opinions and published a survey online, not gone through the peer review process, which means somebody of similar credentials has looked at the work and validated it. So here's our example, is the Centre for Disease Control, cdc.gov. Go and look at that. And an example of morbidity and mortality, a weekly report. Not the most cheerful of subjects, but an absolutely fantastic piece of information, updated on a very regular basis. 100% accurate, 100% trustworthy. Go and take a look. So we've had, just to recap, so authority, who, where do we find them, what's their credentials, accuracy, is the information good, is it published, is it linked back to a publication source, and there will be lots of links in that data, and objectivity, is the purpose of the site clearly stated. This site, for example, this site aims to inform patients, to support patients on osteoporosis, suffering from osteoporosis. And if that isn't clearly stated, you wonder, what is clearly stated? Where is it? What's the intention? Is the information impartially presented? Is it given in a balanced way? If there is sponsorship, is it acknowledged? The people need to tell us if this is supported by a particular product. I could easily tell you that I think a certain watch is great for telling the time, it's really good for sports, all that kind of thing. But if I didn't tell you that I got a free watch from the company, that would be a little suspicious, would it not? So go and have a look at this, melatonin.com. This is a, well, look, you go look at that. And an important word, melatonin. It's somebody has used that domain, the word for a domain registry. That site has been around for a while. So, fourth, in coverage. Does the site satisfy the needs of its intended audience? Is it comprehensive? And does it offer extra features not available in other formats? So, is there a search feature? Has somebody gone to the bother of building in little, if you like, website functionalities that they want to use the medium to promote their aims? And if it is talking about a particular, if we again like osteoporosis, is there information about medication? Is there information about possible surgeries for, say, a hip replacement? Is there information about diet? Is there information about support, physiotherapy, whatever it is? And a site would need to have all of those things to be fully comprehensive and to give full coverage. And my example there would be Medline Plus. And without a doubt, you should have visited this site already. Yes, it's for patients, hugely comprehensive, and it has lots and lots of features not available. You wouldn't get them in print, so they amalgamate lots of different things into one place. Now, here's an interesting one about currency, and currency I mean up to date rather than money. Is the site up to date? And look for a date somewhere on the page, recently updated on X date. For me, if you can't see this date, you have to wonder when it was updated, because it's very easy to put a date in and to stand over it. Also, if there's links within the site, links to external resources, are they kept up to date? Because if they're not, somebody isn't paying attention and somebody's not giving this website the love and care that it might need. And here's a good example. I had quoted BBC Health, and as I say, as I recorded this, I thought I'll go and look and make sure that this site is current and up to date. And I went to the site earlier today, and guess what? It isn't. So what I found very interesting about it is the BBC are so rigorous, and this wouldn't have been a decision that they took lightly. The site featured a number of pages outlining medical conditions and other health information. So the BBC has decided to continue this site because there are now other websites that offer a comprehensive medically checked service, which the BBC was duplicating. So in a way they thought, no, we can't do this comprehensively, and we're going to recommend somewhere else, which is NHS Choices. Now, there's obviously health news and other information, and they've just listed some health links there out to other sources, and I suspect what they've done is they've found key search terms maybe and put them there, but they've linked only to NHS choices, and there is NHS choices. The big thing, I suppose, now as the weather gets a little cooler here in Ireland, is the arrival of the influenza virus, which we'll see pretty soon, I suspect. Um, and this is a site supported by the National Health Service. The about is there, how to contact them, and so forth. So this is a very good site and well worth a visit. So design is a funny issue, and reason it's left for last is because it's very subjective. Um, One person's good design is another person's bad one, and it's very difficult to enforce a uniform pitch here. But do look if it's well organised, if there's an internal search engine. Generally, do feel that's user friendly. If a site has been relied on by many hundreds of thousands of people, design issues will crop up very quickly. Also, within the design issue, there would be considerations for people with disability, and I'll just check a quick check here if that is the case. I'm sure it's in there somewhere. I just can't find it right now. The increasing text size, and in some cases, the ability for the website reader, which can read the page aloud, and there features that increase the usability. So that's very subjective. Is the site useful? Does it work well as a website, or is it just basically a lot of PDFs online, which is what pretty unimaginative. So of the 6 principles there, I would put that as maybe the smallest and most subjective. And go and take a look at those 2 links, see what you think in terms of design. So in summary, we have these 6 subject areas, 6 metrics which you might consider to apply: authority, accuracy, objectivity, coverage, currency, design. Which one suits most readily in a situation that will change, but who wrote it? Where are they from? Are they affiliated with some other organisation? Is the information accurate? Is it biased in any way? Is there a commercial influence? Does it cover everything that we need to know on that subject, or does it cover enough, well enough? Is it up to date? Current currency, not money. And again, as I say, the last one, design. How well is it put together? And a poorly designed website or a quickly designed website leaps off the page. So, to conclude, I'd just like to talk to you about peer review. I've mentioned it before. It has already been mentioned in other lectures. I just want to give you a little bit of information. Peer review. This is important information, and you should know these next few slides well. The peer review, known as refereeing in some academic fields, is a process of subjecting an author's scholarly work, research, or ideas to the scrutiny of others who are experts in that field. So, I produce something as an academic in the Royal College of Surgeons. I want to publish it. Yes, I could publish it pretty much anywhere I wanted. I go online, I buy a bit of web space, I get a WordPress blog, I publish it. And it may have some value. People may think it's fantastic, they may not. But if I have the information peer reviewed and then published, it adds legitimacy and gravitas to what I've written. And the use of peer review is primarily by editors to select and to screen submitted manuscripts, editors of journals, and also to filter applications for funding from grant awarding bodies. So, the peer review process aims to make people like me and other academic authors in the college and yourselves as students to meet standards in the specific discipline you're interested in, or just in general. You need to write to a standard. Other people have written, you're writing to this standard. And it is generally accepted that publications or awards of money that have not undergone a peer review process can be regarded as maybe suspicious in some way or not as professional as would be desired. So this is a quality control issue, a quality assurance issue. Um, but we need to be aware that even within this system there are errors. This will come up again over the time, but no system is perfect, I suppose. So what happens in a peer review process? Uh, so I've written something, I think it's fantastic, I've done some research, I've had ethical approval, I write, and I submit it to a journal for publication. So what the editor of the journal does is finds other people in that field to evaluate the paper. Uh, these experts or reviewers would not know the author of the paper, and the author would not know who's reviewing the paper. And part of the contract with the editor is to send back comments as a reviewer notes, and then these are shared anonymously with the author, who can then respond and change the manuscript as instructed. And of course, this used to happen by post not so long ago, and now it happens online and is much, much more efficient. So just take a look at some of these the papers. So this is something that wasn't published, and it's funny, peer review, as it doesn't always work. There are millions of papers, and this is just a few. Watson and Crick's first attempt was wasn't published. The about weak and electromagnetic interactions by Salmon was not published, but it went on to scoop a Nobel Prize. Papers have been published that turned out to be fraudulent. They just weren't true. So here's a Cochon in Bell Labs, the United States, submitted 15 papers that turned out to be completely fraudulent, and also a paper on theoretical physics that some would say was just jargon, just nonsense. It didn't make any sense whatsoever, but still was published. Other papers rejected here in 1937. The person who first described the Krebs cycle, which I think we're all pretty much aware of. So just to make it, the process is not perfect. So what we have is an increase in access with certainly with the internet, and access to the increase in access to scientific literature, and also easier ways to collaborate. Get in touch with people. We can discuss our ideas. We can send drafts of papers and all that kind of thing, and we can develop electronic communities. But again, not perfect. In my experience, you really need to see somebody. You need to maybe get them on a video conference link or a Skype call or wherever, and you need to have a lot of these meetings to make sure that everybody's doing the same thing. Communication is critical and it is king. Finally, I just want to cover in that is electronic journals. So we've talked about peer review journals and e-journals. So really, the students here in Dublin can take a look at our library. Lots of links either from Moodle or through the main site. And the students in PMC and Bahrain should go and look at their own links, but the principle is the same. E-journals are electronic versions of paper journals. Now, this to you as a early academic on an early academic path might seem that's quite ridiculous. But of course, that's what they are. The E stands for electronic, but you must understand that journals were paper-based. They filled up kilometers of library space. If you wanted a journal, you had to go and find it, photocopy it, or request a copy from the library. It was impossible to hold all the journals in one place, so things were much slower. So we can now view these online. We can get individual papers as PDFs. Or lots of copyright issues around that. But it had electronic journals had a profound effect on how research was conducted. So that they're publications, usually scholarly, that are accessed electronically. And you'll see when you log on to have a look through our library site, some of them are free. Most are available through libraries that would purchase a license agreement. Go and look at the e-journal portal on the library website, wherever you happen to be. If you did this, if you're at home and you didn't go through the e-journal portal, you would have much more limited access to journals. If you go through the e-journal portal, the system authenticates you and recognises you as a RCSI user. So on that note, I want to help promote the use of electronic journals by asking you to take a look at this site here. You've done this, but I'm just promoting it again. This is the BMJ, student BMJ. A lot on this, applying for UK for not relevant to you, but there's a lot that is relevant to you. Students talk about first patient they saw who died, right? Fairly profound stuff. Your first clinical attachment, what's life like on the wards, all that kind of thing. As I said, you can log in, you can register and log in. You can set alerts. What that means is you will get emails from this journal and the group of journals in the British Medical Journal family, about things that you might be interested in. It's a really good way of staying up to date, or just to spend a bit of time reading medical news. And these are how you set up, tick these boxes, you'll get those emails. I really would encourage you to do that. It's a great exercise. The other journal I would ask you to look at, there's so many out there, you can start anywhere you like. The New England Journal of Medicine has much, I suppose we've got okay, it's American, but there's a global element to it. They all have pluses and minuses. So you can also register for this, just so you know, down here at the bottom it says alerts. Let me find that. There we go, services, alerts. So that will be at the bottom of this page. Click on alerts and it asks you, if you're new, you can create an account. Be the first to know, sign up, 19 specialty email alerts. It's free. Okay? There is for the alerts, then you're not going to be charged for those. Create your free New England Journal account. Stay connected with what's important in medical research and clinical practice. You put in your details, off you go. You may feel you're a little way off that. You may feel it's not relevant to you. What I would encourage you to do is to develop your skills in reading medical articles, getting to know the structure, getting to know even the timing of when things are published. It'll stand you in good stead in the future. So thanks very much for listening, and please post any questions you have in